If you look at it like this fishbowl I got right here, if you got dirty water, do they need more drugs, surgeries, or vaccines, or do we need to create a better terrain? So to me, what matters the most is the host.
Welcome to the Dr. Gill Show. This is where we talk about medical matters that matter to you. My guest today is Dr. Jeremy Maxwell. Welcome to the show.
Hello. Well, I'm glad to be here.
Jeremy is a experienced, practicing, licensed chiropractor. He's also my chiropractor. And we just had a very stimulating discussion about what do you call maybe basic traditional chiropractic, manipulation of the spine and the body and helping pain and whatnot. But what kept sneaking into our discussion is the fact that other health conditions affect not only our spine, our pain, but our wellness. And Jeremy has known from an early age that everything is connected. It shouldn't be in my line of work, I'm a fertility doctor. They say, why are you looking at my tonsils? And my joke is, because the tonsil bone is connected to the ovary bone. Now, there's no bone in there, but people say, how can they be connected? Well, we're all interconnected. And what I found when I went to Jeremy for low back pain is he found a whole bunch of other problems that, of course, are all linked together. So this is part 2 of our discussion. We're going to branch out and talk about all these other complementary things that you do with traditional medicine. Now, I'm going to bring up right off the bat that Jeremy used a wonderful analogy in our previous chat about firemen and carpenters. And I love it. Firemen put out the fire, but leave you with a smoldering, charred wreck. But we need carpenters and builders to build us back up. And we also talked about car maintenance. We need maintenance of ourselves to maintain health. So this is where we're going to branch out and we're going to talk about things that we would not necessarily associate with traditional chiropractic, but it's a direction that I think your field, in fact, is embracing.
Yeah, massively. Let's two analogies real quick. I love analogies. Like
I do
listening
too.
People makes it so much easier. So let's go back to this car thing.
Yes.
So look at what technology's done for us as we've moved forward. You literally bring your car in, they hook up a diagnostic thing, it spits out all these codes. And it begins to say, hey, something may be a little off here, let's check that. Or this is showing you need to do X, Y, Z. Our bodies are no different. Like we can take blood work, we can do urinalysis, we can do stool testing. Now, granted, what people need to realize is we kind of have to go outside the standard medical care as far as blood work, because there's a standard that most people get because why? Because that's what insurance covers.
Yeah, there's that.
And then there's certain things that I believe that's all they do because they don't have a medication that they have to actually manipulate those numbers.
Right.
So diagnostically, I don't want to give people the impression that as a chiropractor we're diagnosing disease, but what we're literally kind of looking into or investigating is, okay, is your body operating at the best level possible? Are you in this state of adaptation or homeostasis? And if not, what are some clues that the testing is starting to give us insight into? So that's kind of the deep dive as to how we look at labs differently than just that standard stuff that people are accustomed to getting. And then I love your tonsil analogy to the ovaries, basically.
Right.
We call it the Swiss watch principle.
Oh, what does that mean?
So the Swiss watch principle is this. So if we take off the back of a watch, we're going to see what? We're going to see all these gears. We're going to see big gears, small gears. We're going to see ones with big teeth, little teeth.
Right.
Now, what would happen if one of those teeth broke?
It's all dependent, isn't it?
The clock now can't keep efficient time.
Even one tooth is going to mess it up.
One tooth is going to mess that up. So then I always tell people, it's like, did you know that your big toe affects your heart. They look at me like, what do you mean?
Right.
I come over and jam, you just step on your foot. What's going to happen to your heart?
Your heart's going to go
What's
up.
going to happen to the blood pressure? Can that go up and kill you? Heck yeah. So I totally get how the tonsil, an infected tonsil, can influence a female's ability to get pregnant.
Or
Why?
one that
Because
influences
there's such a massive immune response.
or prevents sleep.
Yeah.
And someone isn't getting deep sleep. They're waking up with apnea. They can't sleep. And all their hormones are screwed up.
So the Swiss watch principle says, like, think of it medically, what do we have? All those gears represent different organ systems. So we have all these different specialties. How many specialists call up the other specialists and say, hey, I found this with the thyroid. Did you check out the adrenals? Well, I'm only the adrenal doctor.
Right.
You're the thyroid doctor. Well, we can't look at the body that way.
Yeah.
I'm glad we have specialists, because if I have a foot problem, I don't want to go to the surgeon who does brain surgery.
Right.
I need the right surgeon to show up.
But we're fractured. Holistic.
We have to look at every single gear, because you and I both know a tonsil that's infected can affect all the other systems, because we know the massive immune system that affects on that. You know, you have an infection. Now we're talking blood sugar involvement. I mean, so the Swiss watch principle is just helping people see, like, from the Wellness Way perspective, that's how we take care of people. We have to look at every system and see that they're all connected.
Nothing is in isolation.
Nothing is in isolation.
Well, you know, we have this HIPAA. There's a part of the HIPAA law that says you can't divulge information on somebody else. But I can talk about myself fine. So I'm going to use me as the index case here to maybe open up our discussion. You were helping with my lower back pain, and I was on my back, and you were touching my belly, and it hurt.
It hurt. Found a couple of places.
Yeah, it hurt. And it turns out in the belly, the back isn't in the belly, but the belly's in the body. And you found digestive issues with me and some other issues. And how can you just ignore that? And you were prepared with your holistic, complementary armamentarium. There's a good word.
Yeah.
All the tools at your disposal just to branch out from just the back. And you found, so you see somebody, and you're not looking just at their back, you're looking at their overall health. Can you give us some idea, what are the things that you're looking at from your philosophy and your perspective of health? Tell us, what are the other things you're looking at
So
in under 100 hours?
Yeah, under 100 hours. So to kind of piggyback on our last episode, we were talking about chiropractic. You know, there's that perception that it's just about getting adjustments.
Right.
Well, I kind of had a reawakening 17 years into practice, realizing that something was missing. And what I realized after hearing Dr. Patrick Flynn talk about the Wellness Way was I wasn't using two of the core principles of what our entire philosophy is based on, and that's these 3 T's: trauma, toxins, and thoughts. So anytime I have a patient come in, those 3 things I'm evaluating. What is their history of trauma? Have they been in car accidents? Did they use a lot of backpacks? Were they C-section? Were they vacuum extracted? Like, all of those things play a role in the stress of the spine. So there's lots of research that shows that the babies who are vacuum extraction and C-section have a higher incidence of asthma, allergies, and many other issues.
Because they weren't squeezed
So there's
out.
a lot
right.
of reasons God designed the baby to go through the vaginal canal.
Right.
Vaginal canal. I mean, to microbiome. I mean, there's so many things that we could divulge on in that regard. But I want to know that history for people because I want to evaluate and eliminate that stressor. Then we want to look from a toxicity standpoint. What's their diet been like? If they were females, did they have a long history of birth control and IUDs? Do they have breast implants? Did they take a lot of medications? Or, like, what's their diet been like? Did they eat too many carbs, drink soda, smoke cigarettes? I mean, all of those things affect our ability to either be sufficient or deficient or toxic. And then I want to know what's their life like. Are they mentally under a ton of stress? Do they have a crappy relationship? Are they in college? All those things, again, as we talked about before, have a huge role in our ability to adapt as human beings and maintain homeostasis. So those three things are what move us away from maximizing our performance. And so in your regard, when you came in, back pain, the focus sometimes is like, well, let's just figure out why the back hurts.
Right, go to the spot where it hurts.
Yeah, we did our analysis. We made our adjustment. You probably went down to like a 2 or a 3 on the pain scale after an adjustment. But as we got into our follow-up visits, now I start evaluating a little more of the internal. So I start poking around on your gut, because you had a little bit of
I did.
The belly.
I did.
And we were talking.
I'm working on it.
Fatty liver type stuff. And so I went to the ileocecal valve, which is kind of that right lower quadrant of the abdomen. We went up and pushed on the liver and gallbladder.
Yeah.
And so we're finding all these little places where you're like, oh, what are you doing?
That was not fun.
So then I'm helping make the connection like, hey, if you've got inflammation here in this ileocecal valve, that could be a reason you have back pain. I've seen so many people have inflammation there. That valve won't stay shut. Waste can back up into the small intestine, and then all of a sudden their back seizes up.
Yeah, pancreatitis. One of the hallmark signs of pancreatitis is horrible mid-back pain.
Yeah. So instead of guessing, I said, hey, let's test. Let's look at some things. Let's do a stool test. Let's evaluate some things.
All right.
And
so
lo and behold.
I tell you, one of the most unsexy conditions is bowels. In fact, I knew as a medical student I was not going to go into gastroenterology. I did not enjoy talking about bowels and stool. No. I did not like it. But I acquiesced. I said, all right, I'll do this stool test. You got people gonna love. You get out a little spoon and a little. It's a spork. You got your nacho tray. You got your nacho tray. Send off the samples.
Yep.
And you found serious digestion and poor digestion problems.
Your pancreatic elastase numbers were extremely low.
Yeah.
Some overgrowth of some bacteria categories.
So I had real gut issues that you. We're prepared to address.
Testing.
Oh, we're going to get to that in a second. We're going to get to that. So, one thing you assess is digestion.
Mm-hmm.
All right, and we've already mentioned antibiotics, and let's explore this a little deeper. We need our bacteria.
Yeah.
Right? Every part of our body that's on the inside or the outside has. In fact, your gut is on the outside. It's outside you. It's in you, but it's a tube that goes from mouth to anus and, in fact, is the outside of your body.
Mm-hmm.
Is covered by a special microbiome, a whole film, a whole community of microbes that we must have. And when we take antibiotics for the ear infections or everybody gets a Z-Pack for a sore throat. All of these bacteria get thrown off. Our digestion gets thrown off, and it leads to just a huge number of problems.
Yeah, that's almost oxymoronic, if you will. Like you and I studied the exact same physiology textbooks.
Right.
And we know that symbiosis is like...
Symbiosis, to work together. Sympathetically to work together.
But then what do? We spend so much time killing what we need. So here's where I think we can blow our audience mind here.
Please.
So Dr. Flynn helped kind of bring this to the forefront, I believe. Not the germ theory, but still, if you look at it, the germ theory is what's really set the tone for years as to, since the medical approach. So they said bacteria are bad, yet they're symbiotic. We need them, but they're the reason disease and all these things exist. But then on the other hand, we have the terrain theory. So you have the germ theory that says if you've got all this bad bacteria, bad viruses, all these things, we gotta kill, seek out, and destroy. Well, how's that worked out for us for the last 50, 60, 70 years?
Right.
If you look at it like this fishbowl I got right here, if you got dirty water, do they need more drugs, surgeries, or vaccines, or do we need to create a better terrain? So to me, what matters the most is the host.
Oh, I love it. With the host.
Let's work on the terrain instead of trying to kill everything. I mean, I love the analogies. I talk to my patients all the time about farming.
Okay.
So if your dirt doesn't have nutrients and you don't have water and you don't have sun, you can't grow a crop. You can't yield fruit.
Okay.
So we have to focus on the terrain. But see, they've even manipulated that terrain over the years to where now they think they can defy, I mean, that's a whole nother topic.
Sure,
but if we can
sure.
focus on the host, meaning health restoration. So if we take those 3 T's, trauma, toxins, and thoughts, we, hook a person up to that diagnostic type machine and go, hey, you're deficient, and let's figure out how to bring some sufficiency there with either supplements or better nutrition, better digestion, north to south. Let's get all this stuff working better.
Okay.
Then again, as we talked about before, the body was designed to express normal function. So if it has proper sustenance, it has limited toxicity, guess what? The body's going to be able to express that and do it. So I really focus on more terrain aspect. So health restoration is what the Wellness Way is all about.
So look at digestion. Can you talk about any, again, recognizing these are not in isolation,
Right.
but what or other organ systems would you as a healthcare provider look at? So I that's use me as another example.
Yeah.
You've checked out my spine. You found spots of high tone, locations of pain.
Well, everyone can relate to this term, inflammation.
Okay.
But I don't know if they always know what that means.
What is inflammation, Jeremy?
So, whether you have an injury to an ankle or whether you have an immune response, the body is going to create an inflammatory response as a healing aspect.
Right.
And that's just, for instance, like as we're finding stressors in your digestive system, it's like, hey, we can work on the stomach and help your acidity be the pH that it needs to be so you break down your protein. We can work on helping the pancreas do its job better. But if we don't address what could be stressing the stomach out, like a food allergy, then it just kind of becomes a moot point, or we're going to hit kind of a plateau because it's all about removing a trigger or a stress. Okay. So if we go to our immune textbooks, we can look up like, a type 2 IgG reaction is considered a cytotoxic hypersensitivity reaction.
Okay.
So I get a lot of people that be like, oh, it's just a sensitivity. I'm like, but by definition, right here in the immune textbook, it says it's a cytotoxic hypersensitivity, meaning it's creating cell death.
Right. So let me delve into this a little deeper. An analogy I use is if you have a splinter.
Yep.
You've got a splinter in your finger. Well, you need inflammation there. You need to spit the splinter out. You need to heal. You need to kill the bacteria. We want inflammation. Splinters out. It heals up. Inflammation goes away. It did its job specifically and precisely.
And it knew to do that.
And it knew what to do.
You directing it, right? That's what's so cool. Like you didn't have to go eat a sandwich. You didn't have to go exercise, and you didn't have to go sleep for that to happen. It just knew.
And what it still amazed me, Jeremy, I cut people open, I sew them back together, and the body, and if I do a fairly accurate job, it goes back. How do it know?
How cool is that?
How cool is that? So there's focal inflammation for a reason that comes and goes. It's this chronic, insidious, smoldering, like a smoldering fire that cooks everything. It cooks your body, your blood vessels, your everything.
Yeah. Now,
right?
What I really try to help people distinguish is that inflammation is very bio-individual. Meaning, inflammation for me showed up a lot as neck pain and some degenerative arthritis. I mean, we know that let's say we eat a lot of sugar as guys. That's a very common thing.
Right.
It's kind of our go-to. And they know in great detail that advanced glycation end products, or AGEs, does exactly that. It ages the spine. It causes that connective tissue to repel water, dry out, and crack. People always want to ask me, how do I not have a disc problems? change your diet, stop eating sugar, quit doing inflammatory things. And so the next person, maybe that inflammatory process shows up as more cardiovascular stress, or maybe it shows up as gut health. So see, inflammation is broad, but it's very different for each individual. That's why I say don't base your need of chiropractic care on pain alone, because if you have chronic inflammation, I mean, how many guys have you come across in your practice, maybe not necessarily your practice, but over just being in the medical field, where someone goes, my friend was perfectly healthy, he was out running one day and had a heart attack and died.
Keeled over, 52.
Guess what? He wasn't healthy. That makes no sense.
Right.
He was 40 years old and, his first sign of the symptom was death.
Was the widowmaker.
Yeah.
Right.
So, so why is that? He wasn't old, and if you were to just do standard medical testing of triglycerides, cholesterol, LDL, HDL, research shows that a lot of guys that have widowmakers, guess what? Have normal cholesterol levels.
And I'm going to have some experts on in another podcast showing that most of this cholesterol is total bullshit.
It is, absolutely.
And I got to say this, Jeremy. When you look, especially in an older population, the higher their LDL cholesterol, the longer they live. I'm not going to unpack it anymore, but that should just blow people's minds. What do you mean they live longer? I heard there's a local doctor that calls LDL cholesterol, he calls it poo. He calls it poop. It's disgusting stuff in your blood vessels, right? Well, the more you have, the longer you live. You tell me that's poo.
Well, here, let's challenge the listeners here.
Sure.
I'll give credit to Dr. Flynn for this. So when it comes to your body and its normal health, since when did your liver make bad things for your heart?
Right. Right. Your own liver.
You're telling me that your liver is going to make things that clog up your arteries. So, what's the purpose of an LDL?
Right.
To me, it's like MoDOT. If you got a pothole, you got to send out the crew to fill it up.
Right.
That's an LDL.
Right. It's for healing and immune function. Yeah, it's blaming the firemen for the fire. I mean, They go on and on.
Well, they show up so.
Well, we went down this path. I guess I couldn't help myself.
See, cholesterol is not good or bad.
Right.
It's necessary.
It's necessary. Right.
How do you expect to make hormones? I remember your testosterone booster guy that was on.
Yeah.
You tell me that you can have strong testosterone and take a statin drug? Ain't going to happen.
Oh, man. I want to go there. I'm going to save that one.
Yeah.
So when you're evaluating someone's health now, you're telling me you're not just looking at the spine and the gut, but you're looking at inflammation and allergies. Mm-hmm. How will you test allergies?
So we do blood work. We use a company called Immunolabs out of Fort Lauderdale.
Okay.
It's a blood print. So we do two different ones. I have 110 foods and 154 foods.
Okay.
We want to remove triggers, stressors. So.
Now, do you also include environmental like dander?
Yep, you can. So I don't do a lot of those because if you remove the food allergy, stress, and inflammation, get to a point where we can do. I'm going to use the word biotransformation instead of detox because that's ultimately.
Yeah, I don't like detox. I don't like detox
because it's, at the end of the day, we've got to take fat-soluble hormones, toxins, and turn them into water and pee, poop, and sweat them out.
Okay,
that's how you got to get that out. And when you can clean up the liver, the kidneys, the lungs, all those organs that deal with biotransformation,
okay,
I've seen personally the environmental allergies go away. Like I was a wreck. 6 years ago, April and August absolutely sucked. I hated them. I literally wanted to die. I remember one morning being in the shower and I'm like, Lord, just let me breathe and you can take my right arm. I can do one-handed adjustments.
He's bargaining.
I can still do, I can test people with one arm. I am that kind of person, but I just want to breathe. Otherwise, just take me now.
Yeah.
So I got off my 31 food allergies that I found out I had no idea about. Got off of those, did my biotransformation, cleaned up the liver, and literally in about a year, August, September, April, May, no problems, no
Is
seasonal allergies.
Is it fair to say you're lowering the burden on your immune system?
Absolutely.
Is that a good analogy?
Absolutely.
I like that one.
I love that.
Yeah, September used to be hell for me when ragweed came out. Much better now. I know people move to Missouri and all of a sudden they have that shower moment. Oh, God, please.
Well, let's tie this into the terrain.
Let's do that.
Okay, like I'm living here in Missouri. I'm outside. You and me are breathing the same stuff.
Right.
The next person, they're like, I don't have any allergies.
Right.
But I do. Like, is it an environmental thing or is it a host problem? Or when you have probably ladies that come in and be like, the storm's coming. I can feel it in my bones. I'm like, we all live under the same barometric pressure. So why do some people feel that and some people don't? I think it has everything to do with the internal terrain. If you're burdened more so with inflammation on the inside, then guess what? Barometric pressure is going to affect you differently than somebody who has less inflammation in their body.
Okay.
Same with these environmental things. Now, we'll test them from time to time because let's say you're allergic to dogs and you don't know and you're constantly living with the dog and we're trying to create a level of restoration and adaptation, yet you keep stressing out your body and burdening it all the time. Well, our job is to investigate and figure out how to remove triggers.
We do some allergy testing as well. So you can test the gut, you can test for allergies. Now, this is where, do you have other tests that you do fairly routinely looking at someone's overall health?
Yeah, we do the Dutch test quite a bit, mostly on the females. So that dried urine test and comprehensive hormones. So that's going to basically look and see what a lady's making. So if they're of menstruation age, we're going to watch and see how their hormones are metabolized and how they get rid of them. So we've got all these different pathways that we evaluate, and then we look at the adrenals on a pretty heavy scale.
Yeah, I'm particularly interested in adrenals. Now, being a reproductive endocrinologist, I'm going to just push back a little. And you said something about 5-10 minutes ago about birth control pills, IUDs, and whatnot. I don't want to give the impression that these are necessarily bad. And there's tremendous benefit from these in certain women. So I don't want people to take away that, oh, gee, I was on birth control pills for 20 years. I'm injured or I'm harmed. I would say generally no, but certainly there can be effects. And certainly something may not be appropriate for someone. It is very appropriate for another. So I don't want to leave the impression that a blanket statement that these things are either good or bad. Okay. Now I'm going to challenge you a little bit on this Dutch test, once again, as an endocrinologist. The powers that be, and I did, I did some reading just in case I missed something recently. Traditionally, endocrinologists get blood tests, blood levels of various hormones. Okay? There is one hormone that you can test in the saliva called cortisol, adrenal function. I really want to learn from you more about adrenal function. Now, the urine is a whole nother world. And the problem with saliva and urine in general is the concentration, how much actually gets in there, and does it reflect what's going on in the body? And these are frightfully complicated. I remember as a medical student, the things that scared the most out of me was endocrinology and immunology. Somehow I got into endocrinology and I understand enough to be certified. But God, it's complicated and interconnected.
Swiss watch. And you said it, the immune system and the hormone system. The immune system is a primary system. Hormones are always a secondary or tertiary response to an immune stress, or I believe a spinal neurological stressor.
Now, would you help me with adrenal? Adrenal. Renal means kidney. Ad means kind of added to or on top of. So we've got these adrenal glands on top of our kidneys that have two basic parts. One that make these, they're called glucocorticoids, or these steroids. And the inside makes adrenaline and whatnot. And you need both these hormones for stress. And when I see in my practice women generally overweight, irregular menses, something called PCO, They're eating the generally ultra-processed American diet.
Oh, yeah.
And
Recipe for PCOS.
Recipe, yeah. Well, at least for exacerbating it.
Yeah, exactly.
For exacerbating it. And they've got these purple stretch marks on their tummies.
Mm.
Now, someone with Cushing's disease, they have super high cortisol levels. Right? One of the things you look for are these dark purple stretch marks on the body. These women don't have the super dark ones. They have what I call the purple tip, but they do have a purple hue to them.
Okay.
I know their adrenal glands are stressed out. The hormones that we measure are typically at least somewhat elevated. So would you tell me about, and not getting good, and our adrenal glands are supposed to cycle through the day.
Circadian rhythm.
Circadian, they're supposed to be low at night, high in the morning. We go through these rhythms. Would you tell me, and it obviously ties into everything.
Oh, man.
So I think we can agree that no matter how we do it, saliva or blood or whatnot, we can document that so many people walk around with a stressed adrenal gland. Would you tell me your take on adrenal stress? I'd love to hear it.
You bet. Well, as far as how we test it regularly, we basically do blood and urine.
Okay.
So that Dutch test is a urine test that will look at a 24-hour cycle of the metabolites of cortisol. So when we measure in the blood, we can see what's being made. And then that Dutch test lets us see, how are you metabolizing cortisol? Do you have the ability to make the DHEA hormone? And then we also look at the free cortisol and cortisone patterns. So it's like a very 1% of, the basic cortisol aspects, but it's a very key component because your body can be in either this cortisol response that's more kind of this stress response, or you can be in a cortisone response that's our natural anti-inflammatory response to pain and inflammation. But if you're in that constant cortisone response, now it becomes very immunosuppressive. Like a cortisone shot is going to suppress the immune system. It's going to interrupt those things. Our bodies, if we're under that constant stress, now you become compromised immunologically. That's going to start messing with your blood sugar because, again, cortisol is going to mobilize sugar.
Right.
Because I see a lot of ladies that will follow our dietary recommendations,
Right.
get off their food allergies, get off the sugar if needed, and then we still see elevated blood sugar levels because their cortisol levels are ridiculous.
Right. That gives you diabetes eventually.
Yep.
So you can, I'm just going to say you can evaluate the adrenal gland, and you can say, gee, it is a stressed out adrenal gland.
Yep.
How would you? So we avoid processed foods, sugar, the allergies.
Mm-hmm.
What do you do next?
As far as supporting an individual from an herbal standpoint, I'm going to look and see based on their entire picture.
Right.
Like how many, like what one thing can I give them that can have like massive influence on multiple systems? Like the Wellness Way approach isn't about these magical supplements that we have and give to people. It's that perspective of what does this Swiss watch thing look like? Which gears are stressed? So if the adrenals are maybe we see some signs of some autoimmune stuff going on. I'm going to lean more towards like a Romania type herb that's going to have an influence on the type of conversion in the kidneys because there's constituents in that herb that influence cortisone and cortisol. Ashwagandha is going to have some benefits as an adaptogenic herb to help just support overall adrenal health.
Well, I see a lot of people on ashwagandha, and I'm totally ignorant. I'm trying to learn about this.
And the right form is key. People obviously shoot for the cheap stuff first.
Right. I know the truth. Echinacea. I know echinacea is greatly dependent on the source.
Yeah. All of our herbs are going to be in tincture form because the best way to pull constituents from herbs is through a certain alcohol content.
To extract.
You're extracting
the active components.
If you're taking powdered forms of those things, you're basically getting anti-nutrients. It's like, it'd be like eating raw nuts or raw vegetables. They don't have
get
the
almost
enzymes.
nothing out of it.
Yeah. So, and that's the key. That's why we study so much of these herbs, is to see what constituents do they have, what's the mechanism of action, and then can we apply that to the physiology that we see.
Okay.
That's kind of the fun and the art of this is, again, when we look at trauma toxins and thoughts, if they're deficient,
Mm-hmm.
and this Dutch test will let us kind of see maybe which pathways, let's say like a lady's very estrogen dominant. We look in production wise, it's high. And then her Dutch test is holding on to a lot of the metabolites, and it's not going down this 2-hydroxyestrone pathway. So she's not converting her fat-soluble hormone into a water-soluble and getting rid of it. It's now storing it in an unhealthy way.
Okay.
If they can eat some good, healthy green vegetables or take like some DIM, a lot of women will want to take DIM, that's helping promote that pathway that may be a little deficient.
What is DIM?
Diindol. So it's chemistry, man. I hate
methionine. Yeah, and listen, I'm just going to interject a little bit here.
Mm-hmm.
One of the things on the Dr. Gill show is that I want people to understand when we give advice here, it is very well vetted and is state-of-the-art stuff. And I just want to make a disclaimer here. I know nothing about herbs and ashwagandha. I know nothing about the Dutch test. I am sympathetic that these things may be helpful.
Mm-hmm.
And I want to say that I'm not approving or anything or saying this is good, but I think I don't see any real harm here. And I think trailblazers like you and other people that are open to herbs that have been around for thousands of years, I just want to say I'm sympathetic to these things. So I'm not putting a stamp of approval on these things, but I want to keep an open mind.
Right. It's like I don't want people to just go out and go buy Romania and go buy ashwagandha. Right. I mean, there are certain herbs, they're so adaptogenic. Again, people have to understand a couple of things. Guess where all drugs came from? They came from herbs.
From plants,
figured out
plants and herbs.
Constituents. They figured out they can't patent food. So you have to take a constituent, synthetically make it, and then you can patent it and make a drug. And that, again, will have a direct stimulatory or inhibitory effect. Now, most drugs are inhibitory. It's a bad day if they're stimulatory. Right. Herbs don't do that. Herbs just supply nutrients. It's just a food. But patients always question the herbs before the drugs. So that's all we're using them for, is to provide sustenance and create, if there's a deficiency, that's why someone can take turmeric and they can have amazing results, and another person can take turmeric and they're like, it didn't do shit for me.
Right.
It doesn't mean turmeric's bad. It just means you weren't lacking in the said constituents that provides.
So just like manipulation, it's very low risk. Mm-hmm. And if you have somebody, and it's not like these herbs you've just gone to the woods and thought, well, I wonder what this is going to do. These are things that have been used for years and centuries.
Extreme vetting in our herbs. We use a company out of New Mexico. They're hugely tested to make sure there's no heavy metals, no bad content in there. You're going to pay for what you get. These are not cheap herbs.
I tell everybody, almost every episode this comes up, you pay for what you get, what you pay for.
Go back to the adrenals.
Please.
Certainly for females, they're going to be probably the more stressed organ. Just, who stresses more, men or women?
Right.
Women.
Right.
Who stresses women more?
Men.
We do. But
Cheers.
That being said, sleep is vital. Women need to be getting 8 to 10 hours of uninterrupted sleep on a regular basis.
Sure.
They're going to need high doses of vitamin C on a regular basis to feed those adrenals. Some need to get off the coffee. Some's not going to be that big of a deal.
So you believe vitamin C helps adrenal function?
Absolutely.
Interesting.
Absolutely.
Yeah, the history of vitamin C is very interesting. If you look through evolution, sometimes we made it, sometimes we didn't. Mm-hmm. You can go through the evolutionary tree and say when we did and when we didn't. So people say, well, how much do you really need? Or did we evolve in an environment where we got so much from our diet? It really was a gene we didn't need or whatnot. There's a lot of controversy about vitamin C. Obviously, Linus Pauling back in the 60s and 70s.
But one thing when it comes to the adrenals and females, because you follow trends and we know fads, the whole intermittent fasting, time-restricted eating, there's definitely a time and a place, but man, ladies, you really need to be careful.
What is your opinion?
Health.
What is your opinion on that? Well, I love this. What is your opinion on intermittent fasting?
So,
we're talking about women here.
When it comes to women, I will make this blanket statement.
Okay.
It is not ever a sustainable lifestyle you should follow.
Really?
Yep. Because much of that has to be dependent upon the health of your adrenals.
Okay.
We can evaluate those and look and see if you have no reserve and you're one of those type A women that has to work out just like a guy 5 days a week, every week of the month.
Okay.
It can absolutely destroy your hormones.
So intermittent, but this person might be fit in normal weight.
Right.
Are you saying
you do that long enough and you will drain the function of the adrenals.
Okay, how about an overweight person who clearly needs to lose weight and in general eat less?
I think they need to cycle it.
Tell me more. Okay, that sounds interesting.
With my own patients.
What have you found?
With the right intent to help.
Okay.
After about 2 to 3 months, it can depending on what the labs show, it can be very detrimental to a female.
Okay, so you maybe see benefits of cycling it, not as a life.
Right. So if you've got an obese female that's got fatty liver, dadgummit, like you got to get off the sugar, you got to get off the fruit, and that's going to take a minimum of a year.
Right.
To get over that.
Right. It took a minimum of a year to get there.
Yeah. But I think it's going to take some regular testing of the adrenal glands to make sure they're capable of doing that. Or maybe a set extended period of time. Now, a guy, knock yourself out,
Okay, so that's been your experience, because I don't treat many. I treat guys sometimes.
Yeah. It's just like, look at our hormone makeup. Testosterone. We go without food, and guess what? Testosterone goes up. You get a female that's trying to go without food, depending on their body makeup composition, the health of their adrenals, very detrimental. And if they're kind of deficient, and we could go down a rabbit hole on whether or not there's adrenal insufficiency, or is it the body's response as a protective mechanism?
Yeah, that adrenal insufficiency. Yeah, in the endocrine world, you've got to fall below a certain number, or they poo-poo it. And very little appreciation for the spectrum.
Yeah, but see, what if the body was responding in a protective way and stopped the overall function and production of cortisol? Because if you're in this, let's say you have an autoimmune condition, the body's trying to not affect the immune system. It doesn't want this stimulation or overstimulation.
So we could have the cart before the horse. We see these in autoimmune conditions. We see adrenal insufficiency, but maybe the autoimmune's not causing it. Maybe it is the response to the autoimmune.
Because if they're in a cortisone response constantly, meaning their body's in this immune suppressing stage, and it's like, crap, we're now in this autoimmune stage, and we're trying to have some level of immune response so that the terrain can react and not be sick all the time.
Okay.
Well, the body's going to go, nope, we're done making cortisol because we got to have some level of a response. So then what if you come in and you start giving this person corticosteroids, you start trying to bring it up, and then...
Many do. I don't do this very often. My practice, I've had to really focus on infertility. But I saw a woman just 2 days ago. They've been giving her all these adrenal steroids, and I think making matters worse.
Yeah. And let alone, again, what about the thyroid? That's going to affect that.
Let's segue into thyroid. How do you I mean, this is a whole nother. I'll probably have a thyroid expert here for an hour. But what are your general thoughts from 40,000 feet on thyroid?
I think it's
not one thing. Thyroid is many different things. There's over, there's under, there's intermittent.
I'll give you my perspective on when I'm speaking to the public. Like I was in Versailles the other night speaking to a very heavily Mennonite population. And these women, it's crazy how many of them are on Levo or Synthroid.
Yeah, especially in the rural areas of Missouri, hypothyroidism is rampant.
And so, I take them through 4 stages of just kind of understanding, like, if you're going to have it properly tested, because what's the standard? What's standard medical procedure?
Well, the bare bones, the old gray hair guys is a TSH.
Yeah.
Which is grossly inadequate for most people.
So it's
and if they'll give it, they'll reflex. Yeah. If it's grossly abnormal,
if the patient
they'll look
pushes
at the
enough, they'll do a T4.
They'll do a free T4.
And if they're extremely integrative in thinking, they'll go T3 even.
Right.
And then if they ever even do a TPO or thyroglobulin antibody, it's like
in
hell
Missouri,
froze over.
I learned that from my mentor, Dr. Penny, who just passed. He said, when you come to Missouri, don't assume a guy has normal sperm. And don't assume a woman has normal thyroid, and always check the antibodies. This autoimmune attack of the thyroid is pervasive.
Yep. So so I'm talking to these ladies as like, okay, are you making enough? Right.
Okay.
Let's look at production.
Okay.
Is it getting converted?
Right.
Is it actually getting used? And is there any destruction that's taking place? So at a minimum, if you don't have those 4 bits of information, you're incomplete.
And that makes so much sense. I mean, that there's no quackery about that at all. You've got to know that.
Yeah, because I've seen normal production,
right?
I've seen normal conversion, and it's relatively getting used pretty good. They don't have like this high amount of reverse T3 going on. But then you look at their thyroglobulin antibodies and TPOs, and they're through the roof.
Right.
So they don't have a thyroid problem; they have an immune system problem. But then the standard is, well, you gotta take Levo for that. I'm like, but Levo only does one thing: it provides a synthetic hormone.
Right, levothyroxine is the precursor of active. So you're taking thyroid hormone that the body will hopefully turns into active molecule where it needs it.
What if your liver's insufficient in its pathways?
Oh boy, it's getting complicated.
Takes place. Most of it's in the liver, some in the gut, other places. And then I always ask the ladies, and I mean, because it's mainly ladies, some men are doing this.
It is more common. Autoimmune conditions are more common in women.
Were put on that medication. Did your doctor appropriately test your adrenal glands?
No, the answer is 0.
Like, what's an adrenal gland?
Right,
or
right.
What?
No, we
I
don't
said, well, here,
at
let me show you what the drug company says about levothyroxine. That it's contraindicated to be given if you have not sufficiently ruled out that you don't have adrenal insufficiency.
Well, yeah. This was a question on my boards, in fact. If you have somebody who's totally knocked out all their hormones, which do you give first? You've got to give the adrenal hormone first, because if you give thyroid without adrenal, they will die. Yeah. Now that's an extreme case, but that's what you're saying is basically true. Mm-hmm. Are there any other tests that you do in your practice that we wouldn't necessarily associate with chiropractic care?
Occasionally we do some heavy metal testing.
What's your take on that? And by the way, what I see about this, I'll occasionally have a man with terrible sperm count. And what brought this to my attention, when I came to Missouri, we have a good number of Amish and Mennonite patients. And then, for those that don't know, Anabaptists, which is the general category of this religion, they don't smoke, they don't drink.
Most of it.
For the most
I'm finding out they do. They're human just like
they're human like everything. And they do have their own health issues.
Yeah.
But it generally ain't due to smoking and drinking too much. and I had an otherwise healthy young man with terrible sperm. He was a welder.
Yeah.
And when you weld, particularly when you arc weld, there is this plume, this smoke that they live in. This smoke has cadmium and mercury, I believe, and let's just say heavy metals in general. Exactly. And he was getting heavy metal poisoning, so it can happen. So when do you test for heavy metals and how?
Yeah, usually we've exhausted a lot of things before we go down that rabbit hole.
Okay.
I mean, it exists. It's legit. But
yeah, it's not super common.
You know, and again, we go back to the terrain. Some people, they're going to be more adaptable. Their liver is going to be able to handle some of that load. You know, earlier you kind of alluded to this load that we get that can be burdensome to us.
Okay.
Some people, if they're already deficient, those heavy metals are going to be affecting them a little bit, you know, more. So we do a blood and urine analysis. I think it's ZRT Labs.
Okay.
We just get these little kits that they send to us that it's a finger prick and a urine test, and it takes a couple of weeks to get.
Yeah, there's different ways to look at it.
Like cadmium, it'll go through radon, I believe. It's got mercury, and then, you know, then if we find some stuff, then we do our best to work on trying to use different binders and things that can try to, you know, pull these things and eliminate them. And it's not something I've personally done a bunch in my practice.
Okay. But it's on your radar.
But it's on my radar, you know.
Yeah.
It's interesting. And it could be, you know, some other things that we can do, or, you know, mold. We do a mycotox screen.
Well, there's a whole the mold world.
But
tell me how do you evaluate that?
Whether it's easy, honestly, I can sum it up. If you got like Lyme's disease, mold, any of those things, I'm going to go right back. You have a terrain issue. You have an immune system problem.
Okay.
I've been bitten by ticks multiple times.
Sure.
You know, never had a bullseye show up, but I know people that have had it.
Sure.
They don't have Lyme's disease. So just because you get bit doesn't.
Yeah, it's a roll of the dice.
Disease.
Yeah, the alpha gal problems.
I mean, that's a whole new deal, which I think's got some liver connections there, and
sure.
And that's kind of a new uncharted thing that they're kind of finding now. But health restoration does not have to be complicated.
Okay.
I mean, it honestly is very simple when you look at it through the lens of the chiropractic principles.
And deal with these fundamentals you're talking about.
You know, I mean, like, we're in the business of health restoration. And I want to do my best to help a client get back into that homeostasis, that ability to adapt to your environment. I mean, that is what the body was designed to interact with our environment. Some people do it better than others. Sure. So if they're not doing it well, something's off with the terrain. And so if we can improve the terrain, so what tests do we do in detail? That CD4, CD8, that detailed immune panel. So that's a way. If we want to really assess your natural killer cells, your viral killers, your cancer killers, your innate immune response versus your adaptive immune response, I've seen some pretty bad labs, you know, and there are medicinal mushrooms, echinacea. There's so many things that can actually feed specific components of the immune system.
That's fascinating. I just want to put up a red flag here. The immune system, the ratios of these, what to do with natural killers, the CD8s and the 4s and the ratio. It is horribly complicated.
Oh my gosh.
And I'm just going to say it's still being worked on. There are people in my field that think miscarriages are due to this problem. And there's a lot of, let's say, not evidence-based treatments based on this. So I'm totally comfortable saying this is an avenue for more research. And certainly in my practice, I'm not prepared to look at those tests, but I'd love to hear your experience doing so.
Well, I mean, they're still discovering things about the human body, the immune system. I mean, what is it?
We've just scratched the surface.
The immunoglobulin D.
I didn't even know about that.
They don't even know what it's for.
But
we know G, we know E, we know M, and we know A. And there's D, but they still don't know what that one does.
I don't even know about it. I just learned something again.
You know, so we're constantly learning about those things, and so that's why some of them are still called theories.
Which brings me to thoughts. You mentioned your final T. Tell me about thoughts. I have heard some people say that a lot of back pain is just in someone's head. I've heard people get extreme. They say, "Well, it's all in your head." Well, it's not all in your head, but that a certain amount of back pain, in fact, is related to
some
thought.
truth to that. And this is where even we start to get a little limited in our scope of what we can do. So I've got some individuals that, if we have to go a little deeper from a subconscious standpoint, because there's a lot of things that, what a deep dive into that. Your first 7 years of life, I mean, you're literally just like this computer download. You're learning by this just constant download, but there are belief systems that are going to come in and play a role into.
By the time you're 3, 4, 5.
Think about a female who got raped.
Right. Oh, I see this all the time.
So there's a mental component that could create some level of pelvic pain or can't get to that level of intimacy.
Right.
Not because she doesn't want to, but there's a short circuit in the subconscious thing, or maybe it's almost always related to a level of trauma, a subconscious belief that can't get out of this cycle.
Yeah. I talk about with Jerry Heisler. I talked to him about. I kept pressing him on tapes, these old tapes, these patterns of thinking and behavior that are installed when we're so young. We don't even realize necessarily we're doing them.
Yeah, and so many people. I don't know honestly how you couldn't know with the age of the internet. I mean, you get on YouTube, and I don't know if you've heard of Dr. Bruce Lipton.
Maybe
the age of the biology of belief. So he was kind of.
Do you like Bruce Lipton? Is he valuable?
I think he absolutely is. Because when I was in chiropractic school, we obviously talk a lot about this innate intelligence. Every cell has this intelligence that by design knows what to do. And he basically scientifically proved that, and he goes into great detail about the epigenetics and that you can turn on and turn off your genes strictly by just what you believe. Like if you change your environment, you change your terrain, you can influence your genetics.
That is not crazy at all. It's absolutely possible, and I'm sure it does happen.
So he dives deep into that aspect. Or then there's Dr. Joe Dispenza, who's very much into just the biology of the subconscious. That you can just. You can go out and there's obviously positive thinking and say these positive mantras over and over. I mean, there's some truth to that, but they're literally like you can change your reality.
You can.
We know neuroplasticity is legit.
We just interviewed Dr. Dave McLaren, a neurologist and transcendental meditation teacher, with objective data, hard data, how mantras could change your brain waves, have real changes.
Oh, yeah.
Many beneficial. So it's not just in your mind. It's an artificial distinction.
But you have to come to a realization that the mind is very powerful in that sense. Because I have men and women who will avoid the food allergies to a T. They will follow the recommendations. They will take the supplements. They will go through the steps and yet not see some of the change because the mental stress throws them under the bus.
There's a role for counseling and personal growth and community fellowship, all things that we do to help each other through life.
Because I mean, in your experience, and I think you can agree and see this, that in the beginning stages of me telling a client you're allergic to 15, 20, 31 foods. You got to avoid this. We've got to stop this immune response.
Right.
Like all of a sudden, you're like, well, shit, I'm a social leper.
Right.
Like, I can't go to a friend's house.
I wasn't too bad.
I can't go to the restaurant and,
Thank God that mine was pretty much just broccoli. Broccoli was just killing me.
Weren't eggs on there?
A little bit. I've cut them way down. I've cut way down on eggs. But broccoli was killing me, dude.
You got to go. Remember, what's an IgG reaction? It is cytotoxic reaction. So even just a little bit is going to create cell death and inflammation.
Right.
I say, if I just put a little bit of dog shit in your food,
Right.
do you still want to eat it?
Uh-uh.
Nope. So if it's red, avoid it like
Avoid
the plague. Remember, no pancreatitis. Got to be nice to the pancreas.
So, let's just say the power of thoughts, part of the whole picture.
Absolutely.
So I want to wind this wonderful discussion down with something that I love gadgets. I love technology. And you and your overall treatment plan have a new modality to heal specific areas of the body. I'll never forget when, I'm not going to say who showed me, but there was this electronic polarity changer thing in the rubber. It was utter bullshit, right?
There's lots of that out there.
Right. I told her. But you have a machine, and you've got a stack of what are called white papers, published data in real journals, real science, right?
Oh, yeah.
Showing benefits of this latest gadget you call soft wave.
It's called soft wave therapy.
Tell me about it.
Non-invasive tissue regenerative therapy using high-speed sound waves.
And they're not so soft. They're not so soft, and they're focused.
Yeah, they're very focused. I mean, the technology's been around for about 20 years. It's been in Europe for a long time.
Do they do a lot of work in Germany?
A lot of work in Germany. Honestly, a lot of the soft wave therapy in Europe is for erectile dysfunction. Because
where do you shock? Prostate?
On the penis.
The
penis? The shaft. So these clinics will actually, inject the meds to get the erection, and then that way you get more access to the corpus.
The corpus, yeah.
And so
cavernosum.
Shock waves, what this technology will do is actually create angiogenesis, so forming new blood vessels.
So let's describe
I want
this.
People to distinguish the difference. Now, I can't say I am not a stem cell specialist.
Okay.
But from my understanding, because I've had the stem cell injections, I've done PRP, I've done the actual bone marrow transplant, into the shoulder and the wrist, phenomenal results. But I haven't personally come across where those actually create angiogenesis. It does regenerate
which means growing
tissue.
Blood vessels.
So to me, this technology is like amazing because it does create angiogenesis, it does create connective tissue regeneration, and it will focus recruiting your own stem cells to that area where there's damaged tissue. So the focused sound wave hits the damaged tissue, which then through the immune system signals the brain, this is where you need to send the stem cells.
So it's kind of focal inflammation, focal tissue reaction where you want it.
So it will, break up scar tissue. Those sound waves basically squeeze the cell. They squeeze the cell and release exosomes. It's the exosomes that go and tell the brain over the next 8 to 12 weeks, we're going to recruit these stem cells to that area. So the treatment's usually once a week for 8 weeks. You have about a 4 to 6 week window where you're doing nothing. You're just waiting. And then we'll reevaluate the patient and see if they need additional treatments from there. But the cool part is there's no needles.
Right.
I believe it does more than just what the stem cell injections will do because we get angiogenesis. Good, healthy blood formation is what keeps tissue healthy and viable.
Okay.
And then in addition to that, it's like a third of the cost. I mean, you're talking $5,000 to $15,000 if you're going to get the actual pull the bone marrow injection.
Right. I
would say we've probably done close to 300 cases since I've had this machine about a year now.
Okay.
I bet they average probably $1,800 to $2,000.
Now, are you doing the erectile dysfunction stuff?
No.
No, I wouldn't touch that.
That is beyond my scope.
Yeah, I wouldn't go there unless I'm a urologist.
That being said, the penetration of the sound waves, depending on the frequency and the intensity we use, will go the depth of a soup can.
Oh.
So let's say you've got back pain. We know that an inflamed prostate can cause back pain. And if we're treating that area, those sound waves indirectly can still get down there.
Go all the way? Interesting.
Now, I'm not saying, we have anybody that comes in directly and they're like, hey, I need some erectile help. I might sit down and explain to them how this could be a benefit. But what we primarily focus on are rotator cuff injuries,
Shoulders.
elbows. So if you got epicondylitis, golfer's elbow, tennis elbow, carpal tunnel, works awesome.
Yeah, you're a big golfer, right?
Yep, love the golf.
Seeing a lot of guys benefit from that?
Absolutely. We do hips, we do knees. We've had failed meniscus surgeries come in, and they do phenomenal.
Interesting.
I have a nurse that I hired that is now doing diabetic wounds. Does phenomenal.
Really?
Wounds, neuropathy.
And that makes sense to bring in healing cells.
Yeah. So part of my motivation for this, again, just being in the chiropractic profession, 80% of the people come in acute pain.
Right.
I've done well to get people out of pain, but I always have that percentage that doesn't matter how amazing of an adjustment I'm going to give them. Right. They're not going to experience relief that day. So I wanted to finally have something to be like, hey, let's get you adjusted, but this is what's going to offer you most likely the quickest relief because of the amount of inflammation it can disperse almost instantly. I mean, it's pretty cool to see what people experience just day one.
Interesting.
And I've got pretty cool videos of people going up and down my steps there in the office before and after. And we did the knees, and it's really cool to see.
I think it's fair to say let's just stay tuned on this.
Yeah.
Look forward
to. If you're interested in that, Soft Wave Therapy Columbia, it's right next door to our clinic, the Wellness Way Columbia. And then I also have one up in Macon, Missouri, with Dr. Heather Gessling.
So, Jeremy, our final topic of discussion.
Mm-hmm.
We left a cliffhanger in our first discussion.
Talked about my neck pain.
Your neck. You had a what they call a slip disc or a bulging disc in your neck.
Yeah. By definition, it was an extruded disc. It was going into the nerve root canal, causing excruciating pain.
And without surgery, it got better.
It got better. Yep.
It got better. Tell me your story.
So I'm in my mid-30s, still trying to actively play soccer on regular. I mean, that was my first love, and it was killing me. Like I had to give it up. I could not play anymore. And this was about the time that my wife is discovering that she pretty much can't eat wheat, can't do gluten, had rashes all over. Long story short, got off the wheat. Drastically changed her mood, changed her skin. So, I'm a little stubborn. I'm like, I don't have any problems. I'm fine. I don't need to, get off that stuff. But I got desperate. Out of desperation, this pain would not go away. So I was on the brink of actually caving and going to see Dr. Rick Wolkowitz and get an injection. I did physical therapy. I did do some Medrol dose packs a couple of times that got some relief. But it was just like everything in my nature I could not cave to surgery. I could not cave to the injection. So I caved to the nutritional change. And so at this time, long before my understanding and practice and principles with the Wellness Way, we would get grass-fed, grass-finished raw milk.
Okay.
Get it delivered from a farmer every week, and we would make our own kefir. So we got these kefir grains, and we would ferment the milk, and I started drinking that. And it was like basically drinking liquid yogurt. And I kid you not, like literally within a week of drinking that, all of a sudden, like I'm sleeping through the night. Like I couldn't remember the last time I actually had 6 or 7 hours of uninterrupted sleep. So I kept thinking, oh, my neck is the issue, so it keeps waking me up.
Okay.
But I started drinking this kefir, and it obviously had an effect on my stomach and digestion, and all of a sudden I'm sleeping through the night. And then literally a couple of weeks, like I went from probably a 10 out of a 10 to like 5 out of 10.
In pain.
And then continued on that journey. And I think it was about 5 years ago. I was up in the Green Bay area, and I said, hey, take an x-ray of my neck.
Right.
I'm just curious. And I had restored almost my curve back to normal. And there literally was no evidence of degenerative arthritis in there.
Wow. I'm going to say
I didn't even hardly believe it.
Like they say, your results may vary, and I don't want to
That's
say
true.
with just the kefir, but an overall something or a combination of things allowed you to object. We can state with as a fact that you had a horrible bulging disc that has gotten better.
Yeah.
So it is possible.
And let's connect those dots a little bit, and then we can wind down here.
Please.
So earlier, I alluded to those advanced glycation end products.
Mm.
So
when you eat too much sugar.
Too much sugar. That's literally all.
Diabetic.
Too much sugar causes you to repel water in that tissue. It dries it out and cracks. Now let's come to digestion. If you have poor stomach acid function and you can't break down proteins to amino acids and neurotransmitters, you have no building blocks.
Okay.
The body's very smart. Doesn't typically make mistakes. So it's going to go into protective mode and go, well, if we can't gain nutrients through digestion and absorption, now we got to go find it. So it starts to steal it from our bones, loaded full of minerals and things that can be used. And so I believe through the research, get on PubMed stuff, like that's how degenerative arthritis happens. It doesn't happen because we get old. Because I've seen 70-year-olds with amazing spines. I've seen 40-year-olds with garbage.
Right.
Look at a diabetic.
Right.
I mean, diabetics are notorious for advanced degenerative arthritis.
And a very high AGEs.
Yeah.
Advanced glycation end products.
So, if people were to ask one question, Dr. Maxwell, what's one thing I can do to improve my health today? Get your blood sugar on point. Get off the sugar. Stop drinking soda. Quit drinking alcohol. Stop eating bread all the time.
Right. I finally made those changes last year. I motivate. I also had another chat with Ty Lathan about motivation.
Mm-hmm.
A professional athlete here, and how do you stay motivated? Mm-hmm. All interconnected. So I think you're saying that with proper nutrition and health, you can heal things in the body that you wouldn't. That traditional medicine might not appreciate, let's say.
Yeah.
Well, I have learned so much from you, Jeremy. What a pleasure it is talking to you. I hope my audience has learned a lot as well. I look forward to you continuing to learn and expand your practice and bring these discoveries not back to us, but back to your patients and improve their lives.
Thanks again for having me. It's been a pleasure.
What a pleasure talking to you.